Let's see. Deanne says, my sister has had plugged, cracking ears. Eustachian tube won't drain since October after COVID. Food sensitivities and tolerances tested, I assume, not tasted. Diet is no sugar, no dairy, no gluten, no alcohol in an attempt to lower inflammation if that's the cause. Also sees a chiropractor twice a week. Ears do get adjusted each time. Still no relief. Any suggestions? Mold. You might have a environmental mold issue, especially with the cracking. I've seen that a number of times in people where the skin is cracking. And I'll see it too. The palms and the feet, the skin on the palms and feet will start to crack. But that would be something I would check for. I mean, the other thing you might attempt too is some of the supplementation that we talked about tonight, supporting her with higher doses of vitamin C, and even a combination of things like NAC, quercetin, nettle, vitamin C. Those things work synergistically together. So doing one by itself might not work as well as taking them all in combination with each other. How can you tell the difference between a cold and allergy symptoms? It's hard. It's tough because they're very, very similar. And some people will say, the difference sometimes can be a fever. But sometimes allergy symptoms can also cause a fever. So I don't necessarily wholeheartedly agree with that. Some people would say that a cold, generally, if it's a cold, it will be precipitated by a few days of extreme fatigue and muscular aches and pains, and then the cold sets in. Although I would say that you can't rely on that 100% either. The best way objectively to tell the difference is a cold. If it's a cold, if your body's in relatively good shape, you should see symptomatic change and improvement within a week or two. And it shouldn't persist and go on. If it's an allergy issue, the allergy symptoms themselves might persist in a much longer fashion. You can go and also get testing done where they run what's called a complete blood count in your doctor's office, and they're looking at, the elevations of certain types of white blood cells. Oftentimes with a cold, you'll see elevations of neutrophils, whereas with allergies, you'll see elevation of a cell type called an eosinophil. But you have to be careful with that interpretation too, because that's not always true. A lot of times you don't see those elevations. And that's in a lot of ways because the people that are being tested sometimes are already immunosuppressed because they're on other medicines, and those medicines have reduced their white counts overall anyway. So it's one of those that there's not a perfect answer. I wish I could give you better than that, but it's a discerning doc who can look at all those different factors and help you make a call. What are my thoughts on using a neti pot? I like neti pots. I think first of all, if you're using a neti pot, you shouldn't be using a neti pot if you have the problem year round. Like, you shouldn't have to use a neti pot every day. Again, if you're doing it for seasonal allergy time to kind of drain and rinse out your sinuses from the potential for allergenic debris getting clogged in your mucus, it's great. But if you have to use a neti pot every day just to breathe, you got a deeper immune problem. But I like neti pots. I think they're very effective and very helpful. Let's see. What's the best test for mold? Depends. If you're trying to rule out mold, like environmental mold allergy, there's a handful of tests where you're looking at different antibodies to different species of mold. So if you're trying to figure out whether or not you're having an allergic response to mold, IgA, IgG, and IgE antibody tests for all the different species of mold is helpful. Now, if you're talking about so remember, mold is like a trifecta. With mold, you can be allergic to mold, but not everyone is. But you can also be being poisoned by mold toxins, which are a very different beast altogether. And in my opinion, the best way to understand whether that's happening is to do mycotoxin testing, and that will give you an indication of whether or not you're being exposed to the toxins that mold produces in high enough quantities to create an immunosuppression effect. And then the third aspect to mold is mold growing inside your body, like a yeast or a candida overgrowth. And there are different ways to test for that too. So like if you're talking about like mold growing in the sinus cavities, a nasal culture swab, the key with the swab is they need to hold on to it for at least a month before they just stop it. A lot of doctors, you go to an ENT or an allergy specialist, they might do a culture, and a lot of times they culture it for 48 hours, a couple of days, and then if they don't see mold growing, they throw the culture away and call it a negative culture. But you really have to hold on to a culture if you're trying to find mold for at least a month. And if again, you have to have that conversation with the doctor doing the test to make sure they're not throwing that culture away too quickly. Other ways to test for mold or candida growing inside of you is you can do a stool sample. There are stool sampling tests that can measure that. And then there are also antibody tests to different species of candida that you can also have run. So there are different ways that you can go about mold, just depending on which one of those areas you're referring to. How do you regain a sense of smell? What supplements or vitamin nutrients work? One of the things people don't realize about smell is olfactory, which is what smell is. You got primary nerve that extends off your brain that feeds your nose. So this is your smell, and it's also olfactory, and then you have another cranial nerve that feeds your tongue and your taste. So smell and taste are both related. So these two are related. Predominantly smell allows us to taste, okay? And this is why a lot of people that get the cold find that they lose their smell and their taste, or things will just taste funny. And one of the reasons why is this. When you get sick, your body sequesters zinc, and it starts using that zinc, because zinc is one of the most powerful antivirals known to man. It does more to inhibit viral replication and viral uptake and viral loading than any other nutrient. And so what happens when you get sick is your body burns through that zinc. And because you burn through that zinc, you can be left in a state where you can't taste or smell. Now, some people, what I've seen resolve, and the quickest I've seen it resolve is like a day or two, is high doses of quercetin, 1 to 3 grams a day, which is really high, right? And then 100 to 150 milligrams, that's a 5. Per day of zinc. The quercetin is going to help get the zinc into the cell. The zinc is going to, it plays a role in osmoreceptors in your nose, and it helps them function. And so again, a lot of people are just extremely depleted of zinc post that cold. So you get these two things going. This is one of the most effective and natural ways to support olfaction and taste. Now, beyond that, some people, it doesn't work. There are some people where that method doesn't do what we wanted it to do. And there are several reasons why and several theories why, but one of them is that the virus itself can damage nerve tissue. And so that nerve tissue, if it's damaged, can take a little bit longer to heal, actually a lot bit longer, 6, 8, 9 months for some people. So it could just be time as well. So if the quercetin and zinc don't solve it relatively quickly, you might have a little bit of nerve damage here, which then you'll want to support your nerve health. One of the things I've also seen work to do this, to support that, is choline citrate, which I've talked about here, especially recently. I did an entire show on choline, but choline prompts turns on. You have to understand that smell and taste are part of the parasympathetic nervous system, and choline is the primary chemical that drives this system to help you smell, taste, digest, rest, heal, repair. So this can also be something that oftentimes has to happen. The other thing we see is post, especially if you ran a high fever for many days, is we see severity of electrolyte imbalance. So what are the electrolytes? And I'm not just talking about sodium and chloride, which is what most people talk about or think about. Magnesium's an electrolyte, calcium's an electrolyte. So you have to, getting those things measured, right? And a lot of times the choline actually with magnesium can be even more effective in some cases. So these are just ideas for you to maybe attempt and try if you still struggle with a lack of taste or smell. Can you take larger amount of omega-3 than the bottle states? Well, I mean, I don't know, Deanne. It depends on which bottle you're referring to. different bottles, different doses. I mean, you can take a lot of omega-3. I mean, there are studies, and we've actually done it, up to 8 grams a day of omega-3. What your cue for omega-3, your limit is if one of the things that we can see when the dose gets high enough or too high is you'll see spontaneous nosebleed. So nose will just bleed without whacking it, without any trauma. Your nose will start bleeding. I have seen that happen with really, really mega doses of omega-3. But I would suggest if you're thinking about taking in much larger amounts, you get your levels checked. You can do what's called an omega check test that measures the omega-3 concentration of your cell membranes. And a simple test, but it'll kind of give you guidance as to where you're at. And what you're looking for in a test like that is you want to get your level between 8 and 12%. Is what you're looking for in terms of omega-3 levels in your blood, in your membranes, in your cells of your blood. Does IV vitamin C contain pesticides? That's a really good question. I don't think I've never seen a study come across where they've looked at IV vitamin C as whether or not they contain pesticides. I mean, that would really be, in my opinion, a question you ask the doctor who wants to administer it is, what is the source of the IV vitamin C? Where's it coming from? What is the raw ingredient source? Is it organic? Like, these are questions that you want to ask. Just like you ask questions about your food, you should ask those same types of questions about anything that you bypass your mouth and directly inject into your body. Okay, let's see here. So Gaia says, I'm non-celiac gluten sensitivity with autoimmune disease. Would it be an option to eat occasional grains, checking or reading antibodies, IgA, IgM, and IgG? No, it wouldn't be, not unless you want to guarantee a failure to recover. I mean, especially if you've got already an existing autoimmune disease, it's a ticking time bomb. You're just pouring fuel on the fire. Porcine kidney powder, where does that fit with histamine reduction? Lisa's asking. So there's a porcine kidney powder that contains concentrated amounts of DAO. Again, DAO, diamine oxidase, will break down histamine. So a lot of people are using porcine kidney powder because of its high levels, okay, it's strong levels of DAO in an effort to try to break histamine down. I would say you can do that, but if that porcine kidney powder if it's not standardized to contain a certain amount of DAO, you don't really know what you're getting in terms of quantity of DAO. And if you're trying to solve a problem, you really want to know, okay, if there's a certain dose that you have to hit. Because what I see some people do, depending on the product, where they buy it, if it's inferior, if it doesn't have adequate DAO in it, they think, oh, I used that porcine kidney powder stuff, it didn't work for me. But what really it could have been is that they used it, but because it wasn't standardized to contain DAO as a certain dose. DAO, to keep it active, it is a very meticulous process. And so that's why a lot of those DAO supplements can be a little bit more expensive. And so what some people have done is just said, well, I'm just going to use porcine kidney powder instead of that supplement in an attempt to try to get the same effect. And look, if you do that and you have the same effect, good for you. But if you do it and you don't, it may not be because the supplement shouldn't have worked. It may be because it just wasn't standardized to contain enough DAO. Let's see, I was negative for a mold test. I assume you mean a swab. Was positive for a small amount of coagulase negative staph, had COVID for 6 months ago using X-Clear and colloidal silver. Any other suggestions? Neti pot would be good, and a good strong probiotic. You also want to support recolonization of your sinus cavities and GI tract. Let's see, are these vitamins available through your office? Which ones do you mean? If you're talking about vitamin C, every vitamin I'm talking about, more specifically, they're available through Gluten-Free Society. I mean, if you're working with me in my office, they're available, but my practice doesn't sell to the general public, but Gluten-Free Society does. Are lentils gluten-free? Yes, they are gluten-free. Let's see, keep going down there. Okay, so are there, well, let's see here. Have you ever used, let's see. So a couple of off-topic questions. Let's see, let's go to, we may come back to those. The B vitamins also help with allergies and food sensitivities. Indirectly, they help because they help your body's biochemistry, and B vitamins particularly help your methylation, and they help your your serotonin and your dopamine pathways. They also help your adrenaline pathways function properly. So, but not directly. Food allergies. My 13 and 15-year-olds are suffering Texas allergies. We've tried everything and nothing has worked. Unfortunately, even Hist Assist. I'm sorry to hear that. Yeah, there's a company in Texas, and they produce a homeopathic remedy specifically for the allergies in Texas. And so you might just look, Nicole, you might look up homeopathic allergy remedies specific to Texas, and you should be able to find that. I can try to remember the name of the company specifically, but I can't remember the name of the company. It's falling off my tongue. But that's what I would try, that search, because that may also work very, very effectively. The other thing that you might consider if Hist Assist didn't work is dosing stronger, like higher doses. The recommended amount on the bottle is about 4 caps a day, but we sometimes get people up to 8, 10 caps a day is where we sometimes start seeing relief. So I don't know if you've done that at that level, but that might be something else that you push to see. I think, so Betty's asking, I think my sauerkraut is my only high histamine food, and I gave it up for a month with no improvement. Should I stop? Only using your Hist Assist, which was doing great. Yeah, I mean, if you're finding that sauerkraut exacerbates your issues, sometimes, fermented food can do that. It doesn't do it in everybody, but again, if you're finding it exacerbates your issue, definitely not a bad idea to give it up. Can I have a reaction or sensitivity with 0 detectable allergies? I've started iodine trying to deal with a chemical. So yeah, you can, but again, if you don't have any detectable allergies, I would argue as to the methodology at which you were tested, Zulu, because if you were tested, in a limited fashion, which is what happens to a lot of people, they go into their doctor and they get tested, but what they get is something called a skin prick. And the problem with the skin prick is that generally what it's proclaiming to measure is an IgE response, which is one of 4 types of antibodies that can manifest with the food reaction. The problem with the skin prick is they'll poke you with metal, which you could be allergic to, and they wipe you down, they wipe your skin down. With corn alcohol. So if you have a corn issue, and so we'll see on these skin prick tests, we get a lot of false positive. That's common. Now, we also get false negative because they're not super accurate. And so you can measure allergies in a lot of different ways, but IgE in the blood is one way to measure what's known as an acute allergy response. There's also IgG, there's IgM, there's IgA, there's something called an immune complex, and then there's what's known as a T cell response, direct T cell response. And so most people, again, this is all they get. And so you're left with your hand, like not having any of that measured accurately, you're going to get false negatives. And so again, depending on how you were tested, I would just say you might talk with your doctor about testing more comprehensively if you hadn't already had all those things done. What system do you use for food sensitivities? It's not a system. It's methodologies, and there are multiple methodologies. There's not one. So I kind of just explained that, Susan, on the board there. Is Hist Assist only to be used during pollen periods? No, I mean, I have some people that use it, that use it even away from pollen periods because they want to keep their dog or their cat. And so they just love their animal so much, but they're allergic to their animal and they want to hold on to them anyway. And so they use Hist Assist in an attempt to minimize or mitigate their histamine response because of a furry loved one. Hey, if you've got a functional medicine or health question that you'd like me to answer for you, make sure you send me an email, glutenology@gmail.com, and we'll do our best to create a video answer just for you. Have a great day.